Hi, this is Hariom for CBNR. Today we are going to look into stretching, right? We have asked this question some time back, what happens if you stretch a muscle, right? Especially if you have pain and you are stretching the muscle. We have asked whether you are actually stretching the muscle or you are perceiving as though you are stretching the muscle. So to sort of visualize what happens when you are stretching and things like that, we thought that we will do a sort of a small demonstration, right? So the demonstration is fairly simple. Have somebody in a crook lying position and put a TheraBand like this and hold it, right? So this movement of abduction, you can assume it to be any range of motion. Say for example, this lateral flexion, this is what we are going to assume today. So this movement, right? So this movement is your abduction and the muscles here are your TheraBand. I have used TheraBand because it has elastic property also, so I thought it will be easier to understand. And this hand, we will assume it to be the brain, right? So in a normal active movement, right? So if you are moving actively, right, as you can feel it, after some time the movement is becoming more and more tougher, because beyond that what will happen is the brain will start to activate the stretch reflex and it will start to or it will stop you from going beyond that particular range, right? And also if you are doing it very fast, sort of there will be some amount of stretch reflex activating to pull you back also, right? This is what happens, sort of what happens in a normal position also. Now if I do it passively, right, if I am passively stretching, right, I can go that, afterwards there is no range of motion because of two reasons. One is the length of the muscle probably, and also most importantly what happens is the brain is getting or making it tighter and tighter, such that after which if I try to stretch it, it will start activating the stretch reflex. Clear? If a patient has pain, right, so when he is doing this he is having pain here. So what happens is the muscle is not literally getting smaller. What it does is the brain holds it, or the brain does something like this. I'll tell you what it means, right? So basically it has made the muscle tighter. So if he does an active movement, you can see it is he's needing more effort, and if I do a passive movement also I need more effort. What the brain does is this analogous, that is this what I'm doing here. What it does is when there is a small movement itself, the stretch receptors or the stretch reflex will be activated, and beyond that it is difficult to move, right? If you do it actively also, beyond a particular range it will become more and more difficult because the muscles have become more and more tighter. So if I am doing a sustained stretch like this, what it will do is the brain will slightly relax and this range will become freer, right? And I do this for quite some time, and I do whether a passive stretch or an active stretch or something, the brain again learns to relax and it will allow you even larger movement, right? After it relaxes better and better, it will allow even larger movement before activating the stretch reflex. So slowly what we call as what range the stretch reflex is activated is getting larger and larger, right? That is how whenever you are doing something to your neck and you are getting more and more range of motion, so what happens is there is a change in your brain. That is, your brain learns and it relaxes, right? So don't think that you're doing something to your muscle or anything like that. Whenever you are doing something to a patient with pain, you are manipulating your brain, right? The brain is learning, not the muscle, right? Thank you so much for watching this video. If you want to see more videos like this, please subscribe to our channel. Thank you.